Hello everyone. Today I'm going to be sharing some information about healthcare clinical and operational data mining. To help set the stage, I've collected a few of the topics that I'm going to be covering today. So what exactly is healthcare data mining? Who is making up the industry and what it is today? Why does healthcare data mining even matter? What risks are out there for healthcare data mining entities? And how does all of this affect our future as patients and what we know as healthcare today? Healthcare data mining, or healthcare analytics, is the practice of analyzing large sets of data to discover patterns, anomalies, and predictions specifically related to healthcare activities, which include things from Fitbit to ER visits. As many of you know, there are two types of data when we think about data mining: structured and unstructured data. One way that healthcare data mining is unique is that companies are starting to delve into unstructured data statistics more through things like natural language processing or recording doctors' visits. In this case, understanding the tone of a patient during their visit can help infer certain aspects of their health and care. The healthcare analytics market is a rapidly growing industry, primarily pushed by the adoption of electronic medical record systems and just the availability of data from hospitals today. However, it is not just hospitals and healthcare systems that are leading this development. We increasingly see companies like IBM, Google, Oracle, and Apple, or others devote resources to understanding healthcare data mining. Additionally, we have multiple government organizations who help regulate and study this information, such as CMS and the NIH. Last year, Grandview Research predicted that the healthcare analytics market was going to be worth $54 billion by 2025, increasing the chances that more companies are going to enter this industry and take a chance at healthcare data mining. So we see this rise in interest in spending into healthcare analytics, but why is this happening? This slide was put together in a recent presentation by Ernst & Young and summarizes some of the top reasons the healthcare market is looking for a disruption in operations. The United States is the largest spender on healthcare at an increasing rate, outpacing our GDP growth and inflation by 5.7%. We see rising costs on the corporate and individual sides, but I think what is the key for hospitals and insurers are the last two boxes, that over $765 billion in unnecessary healthcare spending occurs each year, and that approximately 10% of US deaths are related to medical error. These 2 points are clearly indicative that we have opportunities to improve our understanding of healthcare on a deeper level, and using healthcare analytics can help get us there. For hospitals, there is an ongoing challenge to reduce expenses and to provide exceptional affordable care. Oftentimes, those objectives feel at odds with one another, but healthcare analytics is a deep data diving that can help rectify these factors. Per McKinsey, healthcare analytics is expected to create more than $300 billion in savings in the US alone, with this affecting clinical operations and R&D primarily. For hospitals and healthcare systems, the workforce is often the most expensive factor on the financial statements. So having appropriate staffing is critical towards controlling expenses. At Mercy Hospital in St. Louis, they had a feeling that there was an issue with nursing FTE leakage, where this is the difference between what an RN was hired to work versus what they are currently working. In response to this, they used data from the scheduling and payroll systems to create a nursing analytics dashboard to capture any FTE variances. Knowing who and where the FTE leakage was occurring, they redistributed the scheduling to improve their labor utilization, thus decreasing nursing labor expenses by $4.3 million. Without this streamlined data and capability to analyze thousands of time cards, Mercy Health could not have validated their assumptions and therefore taken corrective measures to increase their productivity. For patients, preventative care is a huge focus for hospitals and insurers to decrease costs. The earlier and more frequently you visit your primary care physician can help decrease costly ED or inpatient stays. At Orlando Health in Florida, they used IBM's Watson Health to identify care gaps in their primary patient population. One example of how the program worked comes from patients with chronic obstructive pulmonary disorder, or COPD. Evidence-based guidelines show the best managed patients visit their primary care physician every 6 months. Those who are beyond the 6-month time frame are at a higher risk for hospital admission. Through this program, Orlando Health and Watson Health initially identified 270,000 people who had gaps in their health based on current guidelines. After reaching out to those patients and reminding them to schedule an appointment or whatever their care required, they increased diabetes HbA1c testing by 7%, monogram screenings by 10%, colorectal screenings by 9%, and generated $6.6 million in shared savings with 2 accountable care organizations. For insurance companies, a large spender on healthcare in the United States, they use healthcare data mining to identify wrong claims and billing data. One example is Anthem. Using their own claims data, their patients' clinical information, and information hospitals submit to them, they use machine learning to isolate fraudulent payments or false claims. Most times, this will lead insurance companies like Anthem to ask for a refund from hospitals for what they unknowingly overpaid. In this case, Anthem can also understand patient risk and the variability in costs patients experience. This helps them to direct where and how patients can receive care to control costs. Per Anthem, the incremental savings have been in the 10 of millions, with more to certainly come as they refine their machine learning technology. With all of this information, there is certainly a large amount of risk that any healthcare entity may face. Most largely, we have system hackings in order to steal medical records or ransomware. More and more hackers are gaining access to hospitals' EMRs by stealing valid vendor information and logging into hospital systems to release bugs that shut down operations. Hospitals are then required to pay a large ransom, most often in Bitcoin, in order to regain access to their systems and continue operations. In this case, medical records are not necessarily stolen, but there is a large demand for medical information on the black market. Healthcare entities also have robust HIPAA standards to meet, which could create severe penalties if negligence was ever discovered following a ransomware system hacking. We as patients also need to consider if we are okay with our privacy being accessible within a healthcare system or a company this way, and how do we hold hospitals accountable to protect it? Do we demand more in HIPAA or other government regulation, or do we include data privacy as another component when shopping for healthcare services? Apple's cloud was hacked a few years ago, and is there a threat to the medical information they may or may not store out there as well? Another question healthcare entities need to ask is if they have the infrastructure to support such a growth in data analytics and big data. As we heard from Grandview Research, the value of the healthcare analytics market is rapidly growing, and that corresponds to a rapid increase in the data that needs to be managed and stored somewhere. Can a standalone institution handle such a volume on their own? Finally, when looking at AI like Watson Health, IBM is very clear that Watson can only recommend, and human doctors are still the critical part of a patient's visit. While we have all of this technology, doctors and hospitals need to remain conscious of not relying exclusively on it. Humans are still able to process surgical interruptions better than robots and contain the emotional intelligence in hard situations. With all this big data, it is important to ask, how do we know that it's right and relevant? So how does all of this affect your experience in healthcare? I have included a video produced by Kaiser Permanente and HP that illustrates how data integration and healthcare analytics can change the way we see doctors in the future.
Thanks to technology, we live in an age of unprecedented convenience. The stubborn exception is a visit to the doctor. Every year in the United States, about 80% of adults visit a physician. That adds up to 1 billion visits. The experience hasn't changed much in the last 40 years. It remains inconvenient, with inflexible hours and unnecessary waiting, and the actual exam feels rushed. The doctor's office of the future will be dramatically different, more akin to the technology-enabled and consumer-driven experiences we're accustomed to in other industries. For starters, the doctor is no longer the focus. Kaiser Permanente is one of the companies exploring what this shift will look like. Rather than you're traveling to the doctor, she will come to you. In San Diego County, Kaiser is testing mini clinics called Health Spots. They're portable, so they can be moved to various high-traffic areas. Patients enter the pods and connect with a doctor over video. She handles routine ailments and only sees patients in person when they need it. Another approach involves locating medical teams throughout a community and throughout the country. The idea is that you won't be tied to a single physician or facility. Again, you'll have options. Kaiser and other companies are testing self-service tools to improve efficiency. After checking in for an appointment via smartphone, you get a reply confirming the exam room and a real-time update on the doctor's availability. Before an appointment, you'll provide details about your condition over email or video. The doctor will be well prepared, and you can be thorough without feeling rushed. The layout of the exam room will change. You and your doctor might sit side by side while reviewing your chart, care instructions, or lab results on a tablet or touchscreen. That could improve retention and compliance, a common problem that contributes to more than $3 trillion in healthcare spending today. In addition to email, you'll communicate with your doctor by text. And increasingly, when he or she sees you, it'll be over video on a phone or tablet. Currently, Kaiser is in the process of enabling video doctor visits at its offices throughout the country. Between wearable sensors and health apps, your physician will begin monitoring your health more closely on an ongoing basis. That level of scrutiny epitomizes where the doctor's office of the future is headed. You'll see less of your doctor, but thanks to technology, she'll see a lot more of you.
So from this video, we learn a lot of things about the future that I think are really interesting, and a lot of things that can help push and develop big data. Having your medical records and all of your interaction with your physicians online, all of that can be aggregated into an EMR and used for Apple or any company's kind of big data projections and analysis. So from the presentation and video, I have put together a few discussion questions. Have you noticed or experienced changes in your physician's practice or in a hospital setting due to technology? Was it welcomed or unwelcomed? Would you trust a diagnosis from a computer more so than a doctor? How do you feel about the aggregation of personal health information? What role does the government play in healthcare analytics development? And what is your reaction to the HP and Kaiser Permanente video? Thanks for listening. I look forward to hearing your comments and thoughts.